Welcome to Medcurity Live. Today we are talking privacy and celebrities. We're going to answer a big question that was pulled from Twitter this week. It was blowing up Kobe Bryant and the early release of his news. Was there a HIPAA breach involved, directly, indirectly? And where is that line when it comes to celebrities and privacy? So we saw some anger directed at those first responders that actually talked to the press. And so we'll dig into that. But first, obviously, as with the rest of the world, it's just devastating news about Kobe Bryant. Definitely absolute legend. My wife and I got to see him playing in Portland a few years ago in his last season, and he got as much applause from the crowd as the home team Blazers did. And so a tragic loss. Just to kind of bring us up to speed, so Kobe, his daughter, and 7 others were tragically killed in a helicopter crash on Sunday morning, and TMZ broke the news first. And then what followed over the early hours was these media outlets kind of stumbling over each other to get the story out, and perhaps sacrificing quality for speed. We saw on ABC News they released that they believed that all 4 of Kobe's daughters were involved in the crash. And then BBC News ran a video of LeBron James playing alongside the news about Kobe. And so some embarrassing missteps. Those were the biggest outlets, but broader than that as well. But TMZ getting to that story first, they got it right. And they had to speak to this because the sheriff of Los Angeles County came out and criticized them a bit, because they broke that news before some of the families or loved ones had been notified. And so Harvey Levin, the founder of TMZ, has gone on record. And so he said that they actually spoke to Kobe's people for about an hour before they broke the news. And they confirmed that Kobe's wife, Vanessa, had been informed and that they were good to release the news. But of course, there were others on board, and that's part of the issue. And he also shared that he received that news from a law enforcement source that he had had for years. And so they got that story out. There's a whole nother story there about whether the media standards of ensuring that family and loved ones get the news before the media breaks it, whether that was honored or not, again, is a different topic. But looking at it from a HIPAA perspective, okay, so per Harvey Levin, TMZ, the news came from a law enforcement source. Now, police officers, law enforcement are actually outside of the regulation requirements of HIPAA. So HIPAA has this scope of applying to covered entities. And covered entities are healthcare payers, like insurance companies, clearinghouses, and healthcare providers. Most healthcare providers are under HIPAA, of course. And so outside of that, and then business associates that provide services to those covered entities, outside of that, HIPAA does not apply. So a police department and an individual police station, ethics aside, deciding to share with a news outlet news like that would not be directly a HIPAA violation. So there was a lot of noise around that, and even accusations that the president of the United States broke HIPAA requirements by sharing out the news. So it's restrained to covered entities. Now, what can covered entities share when it comes to a celebrity event such as this? There actually are some exceptions. You might think they can't say, shouldn't say anything, but there is, under HIPAA and the privacy rule, there is a facility directory exception. What that means is hospitals, for example, can share what would be in that facility directory. So yes, that person's here, and what is their condition? Usually a one-word condition is what's recommended. So they're in fair, they're in critical, they've been transferred. Those are some one-word answers that, whether it's a family member calling the hospital or media calling the hospital or anyone else, if they ask for someone by name, that hospital can share those basics that would be in the directory. Anything beyond that would have to be at the permission of the patient, if possible, or their family members. So as a patient, we need to be aware of that, and we actually are typically informed through the Notice of Privacy Practices. And you'll see that on a wall of a clinic, of a hospital, ideally. It should always be there. That actually, if you read the details, inform you that facility may share the fact that you're there and what your condition is. And you have to specifically opt out of that if you don't want that information shared with anyone who calls in. So that gives some latitude to covered entities to share some basic information. When you have a celebrity in a hospital facility, where that violation often comes into play is actually on the human interest side. It's just that need to know, and it tends to be staff that want to come in and say, what's the condition here? What's the status of this high-profile patient? And there's a few examples here, not too far in the past. UCLA Health actually settled a $865,000 fine with the Office of Civil Rights due to employees viewing Britney Spears and Farrah Fawcett's medical records when they were there at the hospital. We also saw from the Octomom story, her name was Nadia Suleiman, if you recall. She was at Kaiser. Kaiser was fined $250,000, and they fired 15 employees over viewing her patient records when she was there. And then Michael Jackson, his death certificate was viewed over 300 times within the first couple weeks after he passed away. And then Kim and Kanye's daughter, when she was in the hospital, there was actually 6 fired from Cedars Mount Sinai related to that. And then, less than a year ago, if you recall Jussie Smollett's case, he's an Empire actor, and it was a high-profile incident where he came in with face lacerations. 50 employees, including nurses, were fired from a hospital in Chicago for pulling up and viewing his medical record out of curiosity. So if you're staff, if you work in a healthcare facility, don't view the record unless you're directly providing care for that person. I mean, it should be obvious, but this is the easiest thing to audit. As a compliance officer, as a privacy manager, I'm looking to fulfill my responsibilities, and I'm going to audit any celebrities, whether they're bigger names, bigger cases, or they're a local politician or a local sports player. That is the easiest way for me to check and make sure that our employees are following those rules. So just don't do it. There are some exceptions, though, where a healthcare organization could share out some specific information, and where that comes into play recently is, say, with an epidemic. So a hospital can share to the CDC that we've obviously some details that help them investigate and track a disease that's taking place, right? They can even tell you as a patient if someone that was on your flight or someone else in the facility has that disease, if it's potentially a threat to you as a patient. So that's one of those key. Public health is one of the key exceptions in there that gives some latitude, even under HIPAA, as a covered entity, to share information. So this is the coronavirus. We'll answer one more question that was burning up on Twitter and out on Google as well. The coronavirus, is it related to the Corona beer? No. Okay, so it's actually named after the Latin root of the word is corona is crown. And so if you recall, on the Corona beers, there's a crown on the label. And supposedly on these strains there, you can kind of see possibly how these spikes look like a crown, and those spikes are the part of the strain that help it bind to a host cell and infect it. So that's your trivia for the day. Coronavirus, not related to corona. And thanks for joining in. That's what the notes we have on privacy today. We'll be back next week.